Hey, hello, hello, hello. Happy Friday. I'm so happy to see you guys. I'm especially happy to welcome everyone from other countries outside the United States who are submitting questions and watching, everybody in India and South Africa and the United Kingdom. We're so happy that you're with us. And unfortunately, back problems or spine problems and joint problems are universal. So welcome aboard. Welcome to the race, the human race, where we're going to figure out what's wrong and get you to the right doctor, because that's what we do. If that's what you need, we're going to get you to the right place at the right time. All right, without further ado, let's see what's going on. I'm very excited to show you guys some cool stuff this day. It's the human race. Got some interesting new graphics and other things I want to share with you. First question is from Larry Rogers. Hello, Mr. Rogers. Thank you for submitting. I've been suffering with low back pain for over 8 years. Gosh, that's a long time. I started with PT that did nothing to cure the pain. I then went to Northern Arizona Healthcare Orthopedics. After being evaluated, got steroid injections. The injections worked for a while and then no help. Now, we don't know if these injections were trigger point injections or epidural injections or medial branch blocks, but some kind of steroid injections. I was then scheduled for surgery. Insurance got involved and had me go to Mayo in Scottsdale, and that journey began in January of 2020. All right, so back pain started 8 years ago, but now we're two or three years ago. I've received injections and just had radiofrequency ablation on November 25th of 2022. Okay, well, that's very helpful. So radiofrequency ablation, RFA, or burning of the nerves, is a treatment for pain coming from the facet joints. And the facet joints, there's 5 on each side, and when they get arthritic, they can hurt like any other joint in the body. So now we know, at least at Mayo, they think we're dealing with a facet joint problem. It's been 6 weeks. I was told it would take for the procedure to kick in. I'm in as much pain now as I was before the RFA. Radiofrequency ablation on the right at L4, 5, 5, 1, and on the left at 4, 5, and on the left, the 5, 1 facet joints. May said the next option, they said the next option that the RFA didn't work would be surgery. I'm trying to stay away from surgery if at all possible. Is there anything else you would suggest before surgery? From Larry Rogers. Yeah, very interesting. So I understand now you have 8-year history of low back pain. The low back pain was thought by the doctors to be coming from the facet joints. You underwent radiofrequency ablation and got 0 pain relief. And so what's next? Is surgery next? I want to start by pointing something out, and that is that we often think of surgery as like just the thing you do when nothing else works. And that's a huge mistake. Surgery is a specific treatment for back problems, just like any other back problem issue. And surgery is sometimes the first thing you try. For certain problems, only surgery is going to work. And sometimes it's the last thing you try, given the need for severity to justify the risk of surgery. But you never do surgery just because nothing else worked. Surgery is only for basically 2 conditions in the spine, and are 2 of the most common conditions. And one surgery is microdiscectomy for a herniated disc with sciatica. You don't have that. Sciatica is not your problem, so microdiscectomy surgery is not your issue. The second thing that surgery is for is spondylolisthesis, a shift in the vertebrae, with stenosis, narrowing of the spinal canal. And that surgery is laminectomy to open up the spinal canal. And then we would add a spinal fusion in the case of the spondylolisthesis. So laminectomy is the second kind of main surgery, and sometimes you have to combine that with spinal fusion. There's not a lot of other surgery. Like, there are some other minor things and rare things like compression fractures and vertebroplasty, etc. But there's no back pain condition that surgery is usually used for. So it's not something you should be thinking about like that, Larry. What you need to understand is, why did your radiofrequency ablation fail? And there's basically, by the way, I just did a video on this last week, so please check it out. I'm sorry, I did a blog on this last week. It was pain after RFA. But there's basically, if your RFA failed, there's 3 things to consider. 2 main ones, but then a third. The first thing is, maybe it failed because you had the wrong diagnosis. So if the pain is not coming from a facet joint, then denervating a facet joint, burning the nerves, is not going to relieve the pain. It's just not. If you had the wrong solution for the wrong problem, you wouldn't expect it to work. So either it was the wrong problem, or it is coming from the facet joints, in which case there's 2 other possibilities. One possibility is they missed when they did the RFA. And this is not a criticism of your pain management doctor. The medial branches, the pain fibers that go into the facet joints, are highly variable. I've had about as much experience as anybody in the world looking for these little fibers with an endoscope and seeing them. And I can tell you, they're all over the place. Sometimes they're here, sometimes they're here, sometimes they're farther out. They're always on this transverse process, this bone here, but they can be all over that bone, and they can put that radiofrequency probe where the medial branch is supposed to be and miss it. They can also they're human beings. They can make a mistake like anybody else. So either they missed it, or it is coming from a facet joint, but it's not the one that was denervated. So it could be that they're off on the levels. I personally think the best thing to do if you have a failed RFA is to get a second opinion from another pain management doctor. The reason I say that is, there's just different doctors have different approaches, and why not check in with, 2 heads are better than 1. There's no scandal in it. It's not being disloyal or anything. It's just time to try somebody else. So Larry, I think the next thing for you, having low back pain that failed RFA, is see a different pain management doctor and get a different opinion. By the way, if you want to go into it in greater detail, submit a video ask. Submit your question by video and upload your MRI to our online packs so that I can check it out and maybe tell you whether my opinion, good as anybody else's maybe, is there something else going on that might be something else to consider. All right, next question. Hello, doctor. Hello. I love that. I love that start. I asked my question last week regarding my herniated disc and left upper thigh pain since April of 2022. Okay, so we got a herniated disc with sciatica on the on the left since April of 2022. We're almost in March of 2023. So this is, the 10 months, better part of a year out. I didn't realize I could upload photos. I had my MRI done last June. I'm having a follow-up MRI next week. It's getting better. Oh, good to hear that. That's what should happen. The swelling, then would my disc heal on its own within 2 years? My worry about microdiscectomy surgery is that I do live alone, and if I would need someone to stay with me, how long would I not be able to drive and be out of work? Since my work is rather physical and bending and twisting to position patients. Sorry I didn't submit the spine MRI images last time. Here they are for your response, and I got this picture of this MRI. The thing is, Martha, MRIs are done in sections, and there's nothing in this section that shows me what's going on with you. So I got to see the rest of the images. And one way to do that is to upload to my online packs. If you call honestly, you're having the new one done. Please do this call my team, call our number, click through, and they can help you upload from a disk so that I can see all the images and the viewer will let me go through it. And then I can really show you what's going on. Regarding your question about the who do I need at home with me after microdiscectomy surgery, great question. Like any surgery, you really need someone to be there for the first 24, 48 hours. That's just to make sure as the anesthesia wears off that you're safe and that you're good. You want to prepare for surgery by having the house ready. Anything that you normally do needs to be done in advance so that you don't have any responsibilities for at least a week or two. Now, With microdiscectomy surgery, there's nothing that prevents more disc from coming out. So heavy work where you're like a bedside nurse where you've got labor, you can't do that for usually 12 weeks after surgery because the annulus, the outer part of the disc, needs to heal. So long time off work for microdiscectomy surgery. If you can get by without it, you definitely want to, especially when you're this far out. And then remember the matrix, the healing matrix and all that stuff. You'll want to pay attention to that in this situation as well. But Martha, get that new MRI and upload it. Let's take a look at it together, okay? I can't wait to see it. I'm really glad to hear you're doing a little better. That's warms my heart. All right, hi, my name is Jennifer. Hi, Jennifer. Thanks for joining the show. I was the one that did a little video with you on my neurosurgeon having to redo my ACDF fusion at the C5-6 level with C4-5 above it. Oh, I remember that. And I had cervical myelopathy and myelopathy of the cervical stenosis, come to find out. I looked in my patient portal back in 2019 in January. I had a whole body MRI from my brain to my feet because I couldn't walk, and then they told me I needed surgery on my neck at C5-6. Okay, got it. Cervical spondylitic myelopathy of the neck, status post-surgery. Now we've got the adjacent level. My thoracic spine MRI said I had spondylosis at multiple levels. And then in August of 2019, I was falling and I can't walk. MRI of the thoracic and cervical showed Schmorl's nodes in the upper levels. My neurosurgeon did nothing about it. My neurologist saw that on my patient portal 2 weeks ago, and he ordered another MRI on my thoracic spine. I'm hoping and praying for a good outcome. That was 4 or 5 years ago. I've got a funny feeling that it's going to be worse, just like my neck MRI. Of course you do, because when you've had an experience like that, our brains are predictive organs, right? And your experience was you checked the portal, the MRI of your neck showed a bad thing, and then it just got worse and worse to the point that you could barely walk and you had to have surgery. So now when you face a similar situation in your thoracic spine, your brain goes to the same place. But let me say this, it's really, really, really unlikely. The reason is the thoracic spine is very different from the cervical spine. It's a totally different place. It's like a different neighborhood and a better neighborhood. Your thoracic spine has a built-in support structure from your ribs. The ribs help brace and offload and prevent excessive movement in the thoracic spine. So it's actually very rare to develop significant problems of the thoracic spine. And that's why I would be happy to look at those images. I don't have them here, but I'd be happy to look at them and go over them with you. But again, I think it's very unlikely. Last thing I want to talk about is a Schmorl's node. Schmorl's node. It's such a weird word. It's actually a name. So in the spine, we've got the vertebrae that are separated by discs, and the discs are made out of cartilage. And we think about herniations, that's a tear in the outer part of a disc allowing the soft part to come out. We think of that happening here by the nerve roots, but it actually happens all over the place. You could have a herniation out here, but it wouldn't affect anything. This is in your belly, in the back of your peritoneal cavity, and so it's not going to affect anything. But a disc herniation can even happen into the bone. It can happen into the vertebrae. And you can see that very clearly on an MRI. And where a disc is herniated into a bone is called a Schmorl's node. Schmorl, S-C-H-M-O-R-E-L, Schmorl's node, or M-O-R-L. Yeah, I can't remember if there's an E or not. I'm a bad speller. But anyway, it's a Schmorl's node. And the Schmorl's nodes are generally a sign that A, you don't have great discs, and B, you've had something go on there. There's been enough force there to cause a herniation at some point. You should feel lucky that it didn't happen into the area where the nerve root was. But long story short, they're usually not significant. They usually don't progress. And hopefully yours is going to be okay when we get that follow-up MRI. Let me know when you got it. All right, next question. This comes from somebody that's submitted by audio. Let's play that. Oops, hold on a second. I think I need my, I usually don't put my earphone so I can hear them. from somebody had submitted. All right, I just muted me, and now let's get this. Here we go.
So what I'm looking for is some direction. I've been to many doctors, and they're all just kind of different. One doctor is like, you need surgery, your herniated disc is bad enough. So it's a herniated disc of the L5-S1. I think that's pretty common. I just had epidural shots, and my leg is getting, like, there's less pain, but there's still pain, and there's still, like, the worst thing is the numbing. It feels like there's something always in my shoe, always poking me in the foot, and I still get cramps, and I still have sharp pains, like when I overdo it. But I need a little help. Like I said, one doctor said get surgery. One doctor, my neurosurgeon, said you can do whatever you want. He wasn't real helpful, I guess. It was just like, yeah, whatever you want to do. And get a surgery, you can suck it up. You can do whatever. And then the other guy said, hey, get a couple shots and then maybe look into surgery. So I have the MRI. I need to figure out how to load it up to you. If somebody from your staff could maybe reach out and give me a hand, that would be awesome. So a little back history was
So what we've got so far from Randy is herniated disc, L5-S1. Not sure exactly when this happened at this point, but he's had epidural injections. He's seen at least one, maybe two spine surgeons, and was told that surgery is an option if he wants to go forward, which can be very frustrating. Sometimes people are like, well, the surgeon told me I could have surgery if I want to. I don't know, So there's a disconnect between Randy and the surgeon regarding the management of this herniated disc. Let's see what else we can learn.
been pushing through back pain for, I don't know, months and months and months, just being a man. You know how that goes. And one day I woke up right after Christmas, couldn't move, on the ground, screaming in pain. My wife's crying, my daughter's crying. Emergency, we had to call the ambulance, go to the emergency room. They got the pain under control. But the rest is history. Now I've just been kind of dealing with it day to day.
I just want to point something out here because this is very common pattern, and it's really worth recognizing. So he was kind of gutting it out, manning up through some back pain. And then one day he wakes up and it's so bad down the leg that they have to call an ambulance. So what happened there, remember how a herniated disc is, there's a tear in the annulus, and then the soft material comes out and pushes on the nerve root? Herniated disc with sciatica. Sciatica is the pain that the nerve root being irritated. Well, the tear in the disc causes back pain. But the tear in the disc and the soft stuff coming out, it's not always at the same time. And there's no reason it has to be. So what happens very often, and what happened to Randy, was he had the tear, he's gutting it out through this back pain. Feels like a knife in the back, hurts especially when you sit down, can't get comfortable, even hurts at night when you wake up, just a really nasty pain. And then the soft stuff twists wrong, who knows, we can't see inside. So twists wrong, and then the soft stuff comes out, the herniation happens. Well, now, even that doesn't actually hurt. What hurts is when the nerve root gets inflamed. So now that soft stuff is out, the stuff starts to get inflamed. He wakes up and boom. It's so bad he can barely move. It's shocking. It feels like you wake up and you're giving birth to a baby elephant if you're a woman. Like, it's just horrific. And the pain is shooting down your leg. Boom, call the ambulance, get into the hospital, and they can try to stabilize it. So that's definitely what happened here.
Okay. I really haven't taken any much medicine except for ibuprofen. And that scares me, that's taking that long term. But if you can give me any direction, like I need to get back going, like I work on my feet, I move things around, I need some help. And I have a couple kids that I need to be able to move, enjoy, and right now it's just not very good. I'm pretty much stuck on the couch, walking around as much as possible, trying to get as much exercise as I can. But I would love to have another doctor's opinion, especially yours, who has, it would be amazing. But let me know. I appreciate all you do. I enjoy watching your videos and seeing other people out there like me that are going through the same thing and trying to figure it all out. And maybe we can figure it out together. So thanks again, and hopefully I'll hear from you or somebody.
Yeah, I'm so glad Randy, I'm so glad you submitted your question. There are a lot of people just like you going through this, and it is scary to be cut off from your children and your ability to function as a father. You didn't mention it, but you're barely walking, so I'm sure it's hard to be functioning as a husband as well. So it's really a bad situation due to a herniated disc with sciatica. Well, let's take a look at the MRI and see what's going on here. This is Randy's MRI, and this is what's called the axial. So if we took a spine and we made a cut like this and then showed it to you in this plane, but turned it upside down, we would see the disc here, and then the spinal canal, and then the nerve on the inside. And that's what we've got here. This is the disc, and here's the spinal canal. And this is the right side. This is normal. Here's a nerve root, and it's going to go out through this hole. But on the left side, this thing is not the nerve root. This is a fragment of a herniated disc. See this? So there's this big herniated disc fragment just sitting in the spinal canal. The reason this happened, this is the spinal joint right here, and it's inflamed. So this has been going on for a while, or there was some kind of an injury he mentioned last Christmas. And then here's back to more the normal picture. But that's it. That's what's going on. We've got a fragment of a herniated disc in the spinal canal. Now this MRI, I can't see the date on it, but I think it's been a month or two since this happened. I want to point something out. So this disc fragment right there, that is the problem, people. That is the problem. And that is next to the spinal fluid. What's been happening since that disc material is foreign to your body, Randy's body is chewing away at it night and day, and the little white cells are engulfing the disc, and eventually, if they have their way, they're going to take it all away. Remember, our three options for treatment are always the same in this situation. The three options for treatment are shown on this graph. And basically, I want you to think of this as this is our new matrix. The right treatment is in one of these three squares. It's wait and see, or have an epidural injection, or get microdiscectomy surgery. Now, there's two axes. The pain axis, if the pain is just a nuisance, it's not that bad, all the way up to being unbearable. And then there's neurological deficit. Down here, we've got limited function due to neurological deficit, and up here, we've got normal function. So if the pain is just minor nuisance and there's normal function, it's wait and see. If the pain is unbearable and the function is normal, that's epidural injection. And that's what Randy did. He had such severe pain, he underwent epidural injection. If there was limited function, neurological deficit, either significant functionally limiting numbness or weakness or unbearable pain, then microdiscectomy surgery is an option. Having looked at this large disc fragment, I would tell you this, Randy. Science has a lot to say about your options. You're kind of in this category where you have limited function, you can barely walk, and you're now January, half of February, you're now more than 6 weeks out. Here's what science tells us. Studies have been done where they took guys like you and they flipped a coin. This first one, you have surgery, and this next one, you skip surgery. You wait it out. Surgery, no surgery. And what they found was if you go 2 years out, everybody's the same. Whether you had surgery or not, you're about the same. The thing that the surgery does for you in this study was instead of slowly getting better over 2 years' time, you're pretty much better on the day of surgery. The pain down your leg is typically gone. 85% of people don't experience a complication or a recurrent disc herniation or anything else. And they go back to light duty within a week, and they're back to playing with their kids full time within 2 to 3 weeks, and no restrictions, out there playing ball, twisting, bending, doing whatever you want, 6 to 12 weeks. So when the surgeon said surgery, you can decide on surgery, what they really could have said was surgery is an option based on your MRI. The surgery will work for you, but only you can decide whether the risk of surgery is worth going through this, is worth making the healing process so much faster. I would say, based on what I've heard from you, my advice to you is have the surgery. And the reason is, look, man, you're 6 weeks into this or more, you can't walk, you have a free fragment that should be very easy for a neurosurgeon. If you see the right surgeon, they're going to make a 1/2 inch incision, put a tubular retractor in your body, drill off a little bit of bone and just pull that fragment out, and you'll feel better the next day. You can have that done as an outpatient. And if everything goes well, you'll be back at work within a week or two if you're not working already. You probably should wear a brace if you're playing with the kids or working to prevent yourself from having a recurrent disc herniation by moving too much. But you can speed up your healing that way. I'm not you. Now, if you told me, look, okay, great, Dan, but I'm terrified of having surgery, or I can't afford that right now, or I just don't want to do it that way. If there's any other obstacle that I haven't heard that would make surgery a bad option, then not having surgery is an option as well. So you've got two good options. If what I hear in your voice is you're at the end of your rope, you want to be functional, you need to move on, and so that's surgery. If I'm not hearing about all the things that surgery would be bad for, then no surgery. And that's the decision that you have to make. The surgeon was definitely right about one thing. It doesn't sound like they communicated super well with you, but they were definitely right about one thing. And that is, it's your choice. This is based on how you feel in your body. And there's no right or wrong answer, but there's also no one else who can answer. So I would look at this clip with your wife and talk it through and see how you feel and see how they feel and make sure everything's good. And you come to the best decision for you and your family. We're all different. There's no right or wrong answer once again. By the way, what are the risks? What are the risks of this microdiscectomy surgery? Very rarely you can have a tear in the dura, the lining of the spinal canal, which can cause fluid to leak out. And if that happens, the surgeon would need to fix it. Also unlikely, but of equal 5 to 15% risk that more disc, you'll have the disc removed, but more will just keep coming out anyway. It's definitely possible. So in that case, you would have wasted the surgery. You would have gone through it for nothing, but hopefully you wouldn't be actually worse off. So there are definitely some complications. Could you become paralyzed? No. At L5S1, about the worst thing that happened is you could get a foot drop. In one of your ankle would be weak, and in very rare cases that can be permanent. But you're kind of not doing anything now anyway, so not that big of a risk. So that's how I would view it if I were you. I hope this helps. Hang in there, brother. You sound too young to be dealing with this. I'm sorry, but hang in there, and you're going to get better soon, whether you need surgery to do it or not. Hi, my name is Jennifer. Hi, Jennifer. I was the one that did a live video with you. Oh, no, we already did this one. We did this one. Cervical myelopathy. Yeah, I don't know how I got back to that. Okay, let's go to the next question. Brian Quinoco, L45 herniated disc here with a twist from L1, L something 4. Went through surgery for the herniated disc over 7 years ago. Pain was still present 7 months later, but I lived with it because I did not want to go through another surgery. I just recently went through some epidural injections. So it sounds like Brian has a herniated disc from 7 years ago and is still having back pain. And I can't answer this because I don't know. Brian, what you got to know is this pain in the back after a 7-year-old herniated disc? Because that would be likely coming from a facet joint, And then medial branch block radiofrequency ablation would be the way to go. Or is this, surely you're not having sciatica for 7 years. And do you have any neurological deficit? I need to know more. Please, man, click through on the, and leave me a video, leave your question on a video. Tell me your history. I made a little quickie video on the site, on the bestpracticehealth.tv that talks about what to say. Just watch it real quick, record a video and upload the MRI so I can give you a better answer to your question. Hey, I got a question in the chat. Thank you so much. Really appreciate that. Raul Daka, sir, I met a bike accident last month and got my knee injured. Oh man, I'm so sorry. MRI report showing that joint effusion with supratellar tendon extension, large avulsion fracture of the posterior tibial plateau involving the PCL, 3 to 4 millimeter displacement. Seen. Okay, so you broke your knee. You have a joint effusion, suprapatellar extension. So you have an avulsion fracture of the patella. And I need to know a few more things, Raul. Can you walk on it now? Most of these are going to heal on their own. I'm not an expert in this, so I probably need to get a copy of your. Do this. Get me a copy of your MRI uploaded. Call over here or text with my office so that we can upload it, and I'll invite a sports medicine orthopedic surgeon to take a look at it and go over your history with me and tell us what you need to do next, because this is beyond my expertise, I'm afraid. But please do. I would love to know more about you and what's going on, and see if we can get you to get that fixed. What do you think about acupuncture for a herniated disc? This is from Jill Hickey. Hey Jill, thanks for submitting. So acupuncture is awesome. It's a historical practice. It comes from Chinese medicine. They've been doing it for literally thousands of years, as far as we can tell. And the needles are inserted through the skin, through the fascia, and into muscle. And the location of the needle insertion is thought to have really beneficial healing effects. Putting a needle into you does two things. First, it releases anti-inflammatory compounds from your body, just needle penetration. It has the same effect as a non-steroidal anti-inflammatory drug. Also, by needling something, you increase blood supply to that area, so you get a persistent effect in some healing process which can go on. So it's definitely, it's a Chinese practice, but when I'm not an expert in Chinese medicine, but when I look at it I'm an allopathic physician, a medical doctor. When I look at it through the science of allopathic medicine, there's some really, really cool, first of all, observationally, a lot of people get great results. There's some mechanisms that make sense, which I think explain why it works. And so it's definitely a reasonable thing to try. In my own experience as a doctor, having sent patients for acupuncture, I'd say, first of all, you got to go to somebody who knows what they're doing. Going to the wrong acupuncturist, and not everyone, if somebody took a 6-week course and now they are an acupuncture expert, I mean, I'm looking for people who have been practicing this as a discipline for their career, who are deeply trained in it. One lady, Dr. Kelly Shu, who I often referred to people to when I was in practice, was a 3rd-generation acupuncturist and a medical doctor. I felt 100% comfortable that her understanding of the art of acupuncture was so deep and multi-generational and had a scientific, it was almost too good to be true. On a practical level, I've seen some people do it and they're like, meh, okay, maybe I got a little better. I would have gotten more from an anti-inflammatory pill. And then I've had other patients who just had almost a miraculous response. I mean, it clearly, however it works, it worked really well for them. So it's worth it to give it a try. There's nothing specific about a herniated disc. It's a non-specific source of pain, but I would say give it a try. If acupuncture has worked for you in other areas, then go ahead. If you try it and it kind of doesn't do much, it's not for you. So try it if you like, is my advice. Dr. Lieberman, I got my nerves burned today As you know, yes, I do. I'm so happy for you getting treated, Katie girl. My L3, 4, and 5, as you suggested, intracept will be next if that doesn't work. What do you think about the intracept procedure? Intracept is really interesting. It's a denervation procedure for discogenic pain. So RFA, like Katie Girl is talking about, is burning the medial branches that go to the facet joints. You can also get a crack in a disc and pain fibers grow into it, and those pain fibers come from the vertebrae. Now, the way that you know you may have discogenic pain is the disc itself can hurt. That's one thing, but usually there's swelling in the end plate of the bone that you can see on MRI. Remember when I told you guys that a Schmorl's node was the MRI appearance of a disc that had herniated into the bone? Schmorl's node. Well, there's another term for swelling of the end plate of the bone seen on MRI, which is thought to be due to tears in the disc irritating the bone. And those are called modic, M-O-D-I-C changes. So Katie girl, look at your MRI report and look for modic changes or end plate swelling. And if you don't see that, then the denervation, the denervex procedure is unlikely to be, the intercept procedure is unlikely to be successful for you. I did look at your MRI at one time and I don't remember seeing that. So that would give me pause and make me think, I want to check that again before intercept. I would really like to see those modic changes before going forward. Hey, by the way, guys, did you see my video on the chronic pain, the way that chronic pain drugs, narcotic drugs, cause chronic pain in the body by lowering the pain threshold? I used the example of the frog in the boiling water. It's a very cool concept, I think, that really helps explain what's going on there. So please check out that video because it doesn't make sense to keep pursuing treatments for things if the underlying issue is the drugs you're taking. So definitely something to think about no matter who you are or what's going on. I love playing flag football and basketball with my family and friends. That is an awesome way to begin a question. I love you for saying that. That's so cool. I'm currently 25 years old. I was unfortunately diagnosed with severe right-sided L5-S1 stenosis. It's given me sciatica that has been brutal. Yeah, 25, God, that's not fair. Will I ever be able to play with them again? Is this something I can recover from? I don't have any imaging on you, Bradley. I don't have any imaging on you. Stenosis is a generic term that just means narrowing. And so, well, what caused the narrowing? You're only 25. Some people are born with what's called congenital stenosis, where their spinal canal is just too narrow for their body. And in those people, you can develop sciatica at a young age. And no, you can't recover without surgery. It's just the hole's too small. It's got to be drilled open and made bigger. Other people have stenosis because of a herniated disc. And the herniated disc typically gets reabsorbed into the body. So if that's the case, then yeah, once it's done being reabsorbed, your spinal canal, which is from there to there, your spinal canal should go back to normal width and be okay. And so it depends on the underlying cause. Click through here, come to my bestpracticehealth.tv website, give me a video question and upload your MRI to our packs, or at least take a bunch of pictures of it so I can see what's going on, and then I can answer your question better. But good question. Can cervical degenerative disc disease be secondary to thoracolumbar spine degenerative disc disease? Oh yeah, it can. Yeah. I mean, I can't tell you how many patients in my life I saw who had neck and low back problems. And I told them, time out on the neck. Let's start with the low back because the pedestal of the neck is the vase that sits on the pedestal of the low back and the thoracic. If you have lower down problems, if your base is off, you're cattywampus all of the time. And of course it hurts. You have like a built-in functional deformity. So that's never gonna not hurt, right? I mean, that's not gonna work. So I would say get your low back evaluated first. There are some things in the neck. A gal previously had cervical spondylitic myelopathy. Oh my God, that's the priority, right? There are some things in the neck that are going to be the big issue that need to be dealt with first. But if the problem is just neck pain and there's nothing compressing the spinal cord or causing neurological dysfunction, then get the back checked first. Start at the bottom and work to the top, and you'll be glad that you did. Question in the chat. Who's here? Who's here? Salman Notion. I don't know if it's Salman Notion or Notion, but anyway. Can you give me some advice on ozone plus laser treatment for disc herniation? Yes. So the idea of ozone injection to a herniated disc was part of healing is to have increased vascularity and increased blood flow. And the idea of ozone treatment is that it dilates blood vessels and causes tissues to increase vascularity, which organizes healing. And I did do a video on this previously, which I'll remember to drop into the comments so that you can check out. But my first take on ozone was waste of time. It makes sense in theory, but it's unlikely to be successful. Well, I was pleasantly surprised when I actually dug into the literature. There's a lot of trials of this which are too early for me to be able to make a solid recommendation, but are definitely encouraging. And so ozone fits into this area of, if you're excited about it and you've done your homework and you watch my video and you can find someone you trust to deliver it, then yeah, go ahead. It's a reasonable thing to try. Great question, Saima. Thank you so much for coming in the chat. Really appreciate seeing you live. Another question that got submitted earlier, the old-fashioned way, was from Steve Ben. So I have an 8mm herniated disc causing secondary stenosis. Okay, gotcha. Do I need to get surgery or should I wait? It's been 3 months and I'm getting mild radiating pain, but nothing apart from that. Okay, so this is a herniated disc causing some sciatica. So let's look first on the pain scale. He's describing definitely not unbearable pain, it's nuisance pain. So then the next question is there limited function or normal function? Is there a neurological deficit? I'm not hearing anything in this question about a neurological deficit, so that puts me right here, which is in the wait category. Wait. All right. I was just wondering if spinal decompression therapy will help in faster healing. This is a great question. So spinal decompression therapy is generally, it's not, there's no rule that says this, but generally it's a term for traction that's applied by a machine in a doctor's office. And what they do is they lay you on the machine. It's got a halter that goes around your waist, another one that goes under your arms, and the computer pulls you apart. And that traction is really, really good for joint pain. It's really, really good for joint pain. It's a disaster for a herniated disc. It hurts like hell. It's like straight leg raising. It stretches you out and puts more tension over the herniated part of the disc. So if they put you on one of those things and instead of feeling good, you feel like you're about to crack in half, you probably have a herniated disc. So spinal decompression is a great treatment. Traction has been tried and studied for generations. It's really, really good. It really, really helps. It's like brushing your teeth. Wait, what? So it's hygienic. What I mean by that is, if you brushed your teeth today, your breath may be minty fresh and delicious and everything's great. And then you brush it again tonight and it's great overnight. And then tomorrow morning. But no matter how many days you've been brushing your teeth, if you stop, you stink by the next day, right? I mean, traction is the same way. If you do traction and it's working, it's great, but it does not, it wears off. And so that would make me think it doesn't actually promote healing, it's relieving. It promotes relief. I mean, it probably does help you heal a little bit. What most people find with traction is they do it for a while when they have a flare-up and then they're good. So it probably does help somewhat. But really you should think about it as something you do as a treatment to get better. So I think of traction like I think of stretching. It's a great thing to do, but to get the long-term benefit, you have to keep doing it. And spinal decompression in a doctor's office, it just costs too much money to keep doing it forever. No one can afford that. So if it really benefits you and if you want to keep doing it beyond a limited time in a week or two in the doctor's office, then I would recommend looking at an inversion table for your home, for your low back. An inversion table is a table, you get on it, you lift your arm, you go upside down, and it stretches you. There used to be these boots that had hooks on the bottom. If you could sort of hook your boots on a pole, then you could hang. Well, I mean, if you could do that, you probably don't have a herniated disc, right? Or you probably don't have joint pain. So most people, inversion table is a safer way. There's an analogous thing for the neck, which is over-the-door traction. If your problem is neck pain due to joints, and you know, a lot of gals are just because of their chestiness or being pulled forward all the time. I mean, everything is like this, and our work is like this, and everything is like this, and eating, everything is like this. So that traction is just a really healthy and good way to, if you feel like, God, if my head would just lift off my neck, I'd feel better. Over the door traction is definitely something to look at. There's versions of traction now where you lay down and you get some distraction off of a pillow, but the over the door harness, looks like a medieval torture device, to be honest, is the traditional way to get that. All right, so that's my answer on that. Well, I think this is my last question, you guys. So I can't believe it. I'm actually finishing on time for once, which is a miracle. I had bad sciatica for 11 months. Jesus, that's a long time. I'm really sorry. 11 months, 1 month of sciatica is too much. 1 week is too much. But 11 months, that's awful. Meaning I can only walk for 30 to 45 minutes until I have pain in my leg, buttock, and lower back to the point that my hips become shifted. I'm walking crooked and in pain and have to lay down. Just recently, a few days ago. Oh, I'm sorry. Hang on 1 second, Joey. I got a live question from Sam Casillas. My neurosurgeon says I need ACDF at C6-7 to protect the cord. Yeah. I think, what do you mean protect the cord? Like, do you have severe stenosis that's putting traction? Now, Sam, did you ask me the question earlier? Was that you? Let me see. Oh, man. I'm not sure. I would, for a neurosurgeon to tell you that you need an ACDF surgery to decompress the cord, Sam, my guess is he's right. But I would really like a chance to look at the MRI and go over it with you. So if you can, contact us, upload it, and then submit a video ask, and I can do you more justice. But that sounds like the right way to go. Don't mess with that. All right, let's get back to this Joey's question. So Joey's got 11 months of sciatica, poor guy. I went for a walk in the park that was very hilly. After that, my pain became substantially worse. I can't walk for more than a minute or sit on the toilet without being in extreme pain, like someone is stabbing me in the lower back. Jesus, it's awful. I can't sit much at all. I don't know what's happening. When this all started initially a year ago, MRI showed ruptured L4-5. What was initially seen, I'm at a loss for words. Well, I'm all out of tears for you, man. This is just awful. So probably what happened is you had a herniated disc on the old MRI. That means you have a tear in your annulus and the soft part of the disc is extruded. And now you're trying to get better. You've given it a year. This has been going on and on and on. All of a sudden it got enormously worse after a walk up some hilly stuff. Most likely thing is that more disc has extruded out. More disc has extruded out. So what we're looking at is herniated disc with sciatica. Hey, let's take a look at the matrix, okay? And go through what does the matrix tell us to do. So pain, is this just like a nuisance or is this unbearable? This is unbearable. This guy, Joey can barely sit down on the toilet. I mean, this is terrible. Limited function, yeah, can't walk. Microdiscectomy surgery, brother. This is microdiscectomy time. You really should look at it. You would need a repeat MRI since the other one's been a long time. So I would strongly recommend that. But I mean, how old are you, Joey? Do you want to keep living like this? I mean, 11 months of bad sciatica. I don't know how old you are, but that's a year out of your life. It's been trashed by this thing. You're not going to get that back. Damn pandemic stole a bunch of life from all of us. Like, this is enough. You deserve a better life than having to deal with severe sciatic pain. And the other thing is, it just makes you crazy. You know, pain is a warning signal. Pain is about, oh my God, my foot's in the fire, pull it out before it gets burned, right? Pain is about warning us. Anatomists, the guys who look at our structure, if you actually track it down, there's like 7 different pathways that nerve fibers take from the spinal cord into the brain. 3 of them are about the pain signal, but the other 4 for pain are about emotion. It's about how we respond to the pain. So it's not healthy. I mean, no matter how strong you are as a man, as a person, having this, it just gets you down. And it starts to, our brain is a predictive organ, and your brain's trying to imagine your future and let your body respond. Well, for the last 11 months, your future looked pretty crappy, pretty full of pain. And so you start to misprocess life. You start to get depressed. You start to make bad decisions. You start to be without hope for the future, and then you're not that fun to be around. Like, I don't know what your situation is with relationships, but did you guys see that Harvard men's study? They followed these guys for 85 years. So, I mean, it's very unusual for something like this to happen. They followed the same group of subjects for 85 years, and they found not only were the happiest people the ones who had the strongest relationships, but the ones who were the healthiest and lived the longest were the ones who had the strongest relationships. The most important feature of your health, according to that study, was the relationships that you have in your life. If you are in constant pain, what kind of people are you attracting around you? What kind of relationships are you going to have? Not good ones. So, I mean, I say that flippantly. I don't mean it like that. I mean, it's very hard, right? So, man, I really think you need to look at this. You've gone 11 months without surgery. That makes me think you're not the kind of person who's just going to, get surgery super easily. But I'm looking at the matrix and looking at you. I mean, Joey, I just don't see a lot of other ways to go. Thanks for being here. Thanks for your comments, Sam Casillas, Simon Notion, and Raul Daka. I really appreciate you guys chiming in. Raul, you sent me the MRI on WhatsApp. I'll check it out and get it up. It might take me till next week, but I'll try to get a better answer for you. So thanks for doing that. I really appreciate the confidence that you guys showed in being here with me today and giving me a chance to answer your question. I'm really excited for our future together, given the ability for the video ask submission. And again, for everybody around the world, it's not just us Americans who have these issues. Special prayers, wishes, whatever you call it in your life, to the people of Turkey and Syria who are recovering from this massive earthquake last week. My heart goes out to you. If you've lost someone to this horrible tragedy, then please know that the world, we are with you. We wish you the best, and we suffer not as much as you do, but alongside you. We're hoping for you. We're hoping for the best recovery for you. So our wishes to the world, and I'll see you right here next week, same time, same station. I think we have another live next week, earlier, an interview. I'm psyched for that. So come on, check it out, and I'll see you soon. For Best Practice, I'm Dr. Dan Lieberman. If you have a question you would like answered on Best Practice Live, click the link to our website and complete the submission form. The more information you can give us, the better we can answer your question. So please contact us, and we can walk you through uploading your imaging to a secure server. Please like and subscribe to our channel to stay up to date with information about your spine and joint health.